Hello, I'm Dr. Simon, and in a few moments we're going to go into a room and watch the deployment or placement of the Angio-Seal at the end of this case. But before we do it, I thought it's good to review both the components of the device and the way it's set up and placed. So first let's do the components. So when the package is opened, there'll be the Angio-Seal sheath, which will look like this, and then we'll have the arteriotomy locator, which is green, and it's this device here. And these go together, and this is placed through the sheath, and you'll hear a click, and in the video, I'll even say, listen for the click, and that's going to identify that the positioning here is correct. So it goes like this, and now I'll be quiet for a moment. I don't know if you heard it, but you can feel it. So there's both an audible bit of feedback and a sense of a tactile that, okay, it's in the correct position. This is going to go on a wire, which comes in the kit. This is a 70 centimeter 035 wire, and it will go through the sheath you have in place. And you want to do this through a 10 centimeter sheath that has placed this wire in. So if you've got a longer sheath in the case, then you should really exchange it out for a 10 centimeter sheath. Once that sheath comes out, the Angio-Seal sheath will go in. Now this has a hemostatic valve on it, but the key element of this portion of the placement is this sheath has this locator, this arteriotomy locator, and we're going to look for some pretty conspicuous back bleeding, which is going to identify that the sheath is in the correct position. So this will go over the wire. And generally, I have my hand, you'll see in the video, or when we're in the case, I'll have my hand on the groin for hemostasis, and then my assistant, my RT, will load the device on the wire. And so once it's in the right spot, she'll then bring it down to me, hold a little tension on the wire for me, and then I'll bring this up to the groin, and once I've got it in through the skin and bleeding isn't an issue, I'll take my left hand away. Anyway, you'll see it when it happens. At that point, we essentially slide this in along the wire, and we're going to look for that bleeding. And when you see me do this case, you'll see I'll go in, I'll get a very obvious flash. I'll then come back. I'll go back in, flash, come back, which will show us bleeding back here, and it will be fairly obvious. It's not going to be a trickle. It will actually be very definitive that we are in the artery. The blood will come through here. And so you'll see me in the case. I will go in, out, in, out. It's a very crucial step because we're trying to position this sheath at the right spot in the artery. So we've now positioned this correctly. We have our bleeding. I support the device with one hand. Out comes the wire and the vessel locator. There'll be no bleeding. This is a hemostatic valve. My RT will then hand me the device with the bypass tube. We will use this to go in through the hemostatic valve, and this has a shelf on it. So we'll push it down till it can go no further. Then we're in the right spot. We've now loaded the closure device into the sheath, and we slide this down. There may be a little blood, maybe a little blood coming back. That's pretty normal. We'll push this in until we hear a click. Again, I'll be quiet. It can go no further than this. So this is the correct positioning. At that point, I'm going to take this hand away just so you can see it. Notice that the anchor has now come out the sheath, and you can see I can move it. With the device supported, this will not be something we see in the case. When we go into the room in a moment and we go through these steps on the real patient, this is not something that we can see, nor we will see. It's happening inside the patient. We will then pull back until we hear another click. Click. This is now pulled back correctly. And what's happened is The anchor is now locked against the sheath. Notice. We will then, and in the case I will describe this as sliding this back with really the tension of tying a shoelace. Now what's going to happen is we'll see our anchor, the collagen will make its appearance in a second. Now this collagen in this case is going to be dry. Again, you're not going to see it when we do it in the case, but the collagen will have been moistened by the patient's own blood. And here's the anchor, here's the collagen. This is what it looks like dry with the anchor. And we keep pulling. That's our tamp. And we pull with the tension of tying a shoelace, or as I say, plucking a guitar string. When we do the case, I probably will use that very same description. That's our tamp that you've seen. And we pull, and the tamp will now be used to take this collagen and do exactly that, tamp it down. And so, again, this is not something we're going to see when we do it on the patient. It's all happening inside the artery. We then tamp, but I am going to describe like bringing this down and looking for a black marker, which tells us we've reached the point of the collagen being correctly tamped down. And there it is. It's fairly subtle, right there. When we do the case, I'll probably wipe this suture down with a gauze to remove a few drops of blood. It's not something that needs to be done during the case, typically, but for the purposes when we go in there, you'll see it. So there's the black marker. My RT will then hand me the scissors. We'll cut the suture kind of just above this tamp, and we'll slide the tamp out. And now you can really see this black marker which identifies that the collagen's been tamped. Again, this suture will be sticking out of the patient. At that point, I usually will apply a little bit of pressure on this suture, and I'll take my hand, and one last time, with just my fingers on the patient's skin, I'll push down, applying some light pressure on this suture to kind of, it's the last moment to kind of, one, express any blood in the tract that will come out, and also the last moment to kind of get some final pressure on this collagen to see to it that it's down. This is both the intravascular component, the anchor, and the extravascular collagen. That's the beauty of the Angio-Seal, that you have these two components. Again, this is out the skin. We then apply some pressure. You'll see me doing this in the case. I then put a little pressure on the skin, cut, and that's the deployment. Let's go into the room and you'll see it.